So there are three really popular ways of diagnosing necrotizing fasciitis. The first way is a biopsy. And a biopsy, which is also known as a BX in medical terminology, is where the doctor will take a sample of the tissue of the infected area and send it into a lab where we can look at it more closely through a microscope and we can really see what's going on in the skin. And that kind of leads into the second way, which is drawing blood from the patient. This is technically where a phlebotomist would come in and he or she would look at the RBC or the WBC, and typically if the WBC, which is the white blood cell count, is higher, then we know that something may be off and that our white blood cell count or white blood cells and the lymphocytes might be trying to fight off a bigger infection than we think it might be. The third and final way is an MRI or a CT scan or even an ultrasound. And in the MRIs, they use a big magnet and radio waves within the magnet, and those waves flow throughout our body, and we can look closely at organs, which this disease can affect, and the more structures of our bodies. Through a CT scan, we get a mix of different x-rays taken from different angles from our bodies, or we can see how deep maybe the infection is hitting our skin. And then ultrasounds, where high frequency sound waves are used to create an image on the inside of our body. And typically this is going to be more used if the necrotizing fasciitis is affecting our organs. So yeah.